is Dr. Petronila Tabansi, the President-elect of Paediatric Association of Nigeria, and I welcome you to this first series of PAN webinar for the year 2025. Today's webinar will be taken by the PAN School Health Program Committee with their able chairman, Dr. Ughasoro Maduka, who will moderate. So I'm sure we're going to have a very nice session. They'll tell us more about it. For now, I want to invite the Amiable PAN President, Dr. Ekane Mekure, to give a welcome address, after which the chairman for the committee will take over the moderation. Madam President.
Thank you very much, Madam PE. And as far as webinars are concerned, Happy New Year to everybody. This is our first in the year 2025. And we're very excited in the association that this is going to be started by one of the committees of PAN that are very active, ably led by Dr. Maduka Ughasoro. For those who were at the conference, you will remember that the main focus was letting people know that every sector is important and education couldn't be any less. So school health is a vital part of child health as far as wanting to see an excellent outcome in children is concerned. And Nigeria is not an exception. We all know that school health is not exactly as it should be in our country. And so we all need to learn how to speak about it, how to go about it so that things can change in the school sector concerning our children. So at this point, I want to appreciate the committee for putting this meal that we're about to take together. I'm certain that we are all going to live empowered, for that is their main objective. So thank you very much, Dr. Maduka and team, for the preparation. And our sincere hope as an association is that we will not just listen, we will put into practice what we hear, and we will begin to make a difference in what happens in schools concerning our children. Thank you and welcome once again.
Dr. Ughasoro, you can go ahead and begin the moderation, empowering pediatricians with school health advocates.
Okay, good afternoon all. Good afternoon.
Good afternoon.
Okay, I hope
good afternoon.
Okay, I hope I'm audible enough, and I just welcome all of us to the first PAN webinar for the year 2025. And without really wasting much of our time, I want to start on already established protocol. In the next 1 hour or 1 hour, 30 minutes or thereabout, we'll be deliberating and discussing on a very important issue which affects the life of our children and all the people in school. And today, I'll be moderating the section, and the key speakers are Dr. Muhammad B. Farouk from Abubakar Tafawa Balewa University, Bauchi, and also Dr. Florence Dedeke of Federal Medical Center at Abeokuta of the state. And the topic that will be guiding our discussion today is empowering pediatricians to advocate for school health. And we believe that at the end of the day, we must have stimulated ourselves well enough to see how we can help in ensuring that the school health program really impacts the way it should. And without really wasting much time, I think the handler should share the slide so that we'll take off. The slide, please.
You can share.
Hello.
The presenter can share his slide from their end. I wasn't sure. The presenters have the access, the rights and permissions to share their screen.
If you have it, share it. We're having challenges with using our system. So most of us are using our phones to do this.
Okay, let me.
If you want us to share from here.
You don't have it. The system is not connected. You see that one? Let me check the one.
My chair, would you want me to do it from here?
Hey, please, if you have it, just go ahead. Because,
let me just do that.
Please share so that I can move. Can
you see my screen now?
Okay. Okay. Yeah. Thank you, Dedeke, for that. Okay. So, like I rightly introduced, the key speakers will be Farouk and Florence, and our objectives. Just the next slide. And our objectives are we try to achieve by the time we're done with this interaction today. It's, we'll be able to give us our findings from the situation analysis based on some of the key performance indicators we evaluated in our previous survey, so that we'll appreciate what it was before the policy was introduced in 2026, but 2006, and what it is when we did the survey in 2022. And also highlight what I expected the pediatricians to do in an attempt to bridge the implementation gap that we are identified. And after which we'll get into the interactive section where we want to invite each and every one of us to, come up with our qualities and see how best we can improve our school health. So Dr. Farouk will take over from now. Over to you, Dr. Farouk.
All right, thank you very much, sir. As I was introduced, my name is Dr. Muhammad Bashir Farouk from ATBU in Bauchi. As we all know, the first contact that our children usually have outside the home environment is their school. And therefore, they spend significant number of time staying in the four walls of school. Because of that, we need to make sure that everything health-wise, while they are staying in that school, is okay and optimal. And we know that Nigeria has relatively a young population, with about 23% of the population termed to be within the bracket that we call school age. Now, 2 out of every 3 young adults, according to UNICEF, is in school. And an estimated population of over 20 million are in primary school, while over 16 million of those children here in Nigeria are in secondary school. So you can see that a huge proportion of our children and our young adults are actually in school. So why do we want to bother ourselves with school health program? We all know that a healthy child is more likely to attend school regularly and participate in all school activities. We also know that a healthy child is more likely to sustain school, to be in school until he finishes or she finishes. And of course, completing basic education is also more likely to be found in somebody who is healthy than somebody who is sick. So a healthy child, in terms of enrollment rates, retention rates, as well as finishing basic education, which we all say we want to achieve amongst our children, is more likely to be found in child who is healthy. Now, deliberateness is needed in order to achieve education for all. And that is what eventually gave rise to the school health program. So what is school health program? By way of definition, it is an integrated set of planned and sequential school-affiliated strategies, activities, and services designed to promote the optimal physical, emotional, social, and educational development of students. Now, it is not a haphazard activities. They are actually planned, and they are sequential because one actually contributes to the other. And they are all found within school, and that is why it is said school-affiliated strategies. And it involves activities and services that, whose ultimate aim is to actually promote and have optimal physical, emotional, and social development in our children. Just like we define health, not mere ailments or infirmity, it's the same thing with school. School health program. So what are the components of school health programs? As we said, there are sets of activities as well as strategies and services that are geared towards optimal health of our children. Number one, school health services. So issues of clinics, provision of treatment of common ailments, referral strategies, and all that are components of school health services. That is one of the components, or first among the components of school health program. The next is healthy school environment. We want our environment, the school environment, to be as healthy and health-friendly as possible. An environment that promotes and protects health of our children. Next is physical education, where we encourage our children to go out there and physically exercise themselves. Next is comprehensive school health education. So in school, in classrooms, they will be taught some basic things about how to promote health generally within themselves, within their families and communities. Next is school site health promotion for staff. So the attention is not only on the school children, but rather the people who are entrusted with the responsibility of teaching them and caring for them. They also need their health to be promoted. Next is counseling, psychological, and social services. And that is very important. Just like we said, health is not just mere absence of physical ailments, but also psychological well-being of even children, not only adults. Next is nutritional services, which we know how nutrition plays an important role in the overall development and growth of children. Next, and finally, is a strategy. How do we achieve those things? It's through family and community involvement. So that is the strategy that is used in achieving those items. Now, school health program, we know when it is effectively implemented, it has significant impact on health and quality of life of our children and young adults. The recent growing interests in the health of our youths and adolescents is exemplified by most stakeholders. Top among them is our dear association, the Paediatric Association of Nigeria. We all are aware of the African Youth Charter and also the Maputo Plan for Action, all of them geared towards achieving healthy youth and adolescents. Now, the urgent need for awareness on school health program and facilitate implementation of its components was also espoused by Adebayo et al. In 2013. So it is because of that, and in line with this increased awareness and growing awareness, just like our president just said in her own opening speech on the school health program, that in 2022, the immediate past administration or regime of our association inaugurated the School Health Technical Working Group, which was renamed last year when the present administration came on board to PAN Subcommittee on School Health Program. Now, that technical working group in 2012 and in 2022 had organized and in fact did a situation analysis across Nigeria. And we got approval from the National Health Research and Ethics Committee in 2022, where a total of over 100 schools comprising of both urban and rural, private and public, primary and secondary schools were selected from 6 states across 5 geopolitical zones in Nigeria. Now, a little about the outcome of the situation analysis that we saw or we found. With respect to school health services, we realized that pre-entry medical examination and screening was found in just about less than 40% of the schools. And a little over half of them have teen health screening and examination. Less than 30% of them allow for specific immunization, while availability of clinics, sick bay or school clinic is seen in just about 47% of those schools. Availability of first aid boxes was found in about 46% of those schools, and about half of them have referral services, and less than 30% have retainership with established health institutions nearby. About 37% of them request for immunization records of children when they are in their care. And only, in fact, less than 20% of the schools have trained health personnel manning some of their clinics or sick bays. Now, with respect to healthy school environment, we found that there was significant number of them that had the wash, water, sanitation, and hygiene process in them. And then about similar number were satisfied with their school environments. We didn't have information on physical education, neither did we have on comprehensive health education. Also, school site health promotion for staff and family and community involvement were also not part of our survey. But when we looked at counseling, psychological and social services, we found out that almost half of them actually have mental health counseling. And nutritional services, about half of them also have nutritional assessment of the children while they are in school. And of course, didn't also have data on screening for the food handlers in those schools. So after that situation analysis, what we did was we tried to push out what we found for the benefit of the society and policymakers. And in line with that, we had two publications. One of them, we looked at the performance, the overall performance of school health program in Nigeria, a situation analysis. And the other one, we did a position paper by the Paediatric Association of Nigeria on that same issue. So by and large, if we look at everything that we found, we realize that some of the key messages are that there was inadequate knowledge of national school health policy across the country. And that was corroborated by the findings of Ademo in 2016 and Ademi in 2015, 1 year before that. We also found out that the overall there was overall poor implementation of the school health services, something that was also reported in 2016 by Koponi as well as Chidebera. We also found poor implementation of pre-enrollment medical examination, which was also corroborated in 2016 by Chidebera and also 1 year later in 2017 by BC Oyemachi. Next, we found that the availability of first aid box in many schools were there, but they were inadequate. And that was the same finding by the researchers I talked about earlier on. They also found the same thing as we did in terms of availability of medical records, which ranged from 33% to 64%. Now, whose responsibility is school health program activity or effecting or implementing school health program? We believe that government is at the center of it. Whatever we do, even in private schools, it is government that has the responsibility of making sure that school health program activities are implemented. So we say on top of our list will be the government. Next, medical doctors. And in particular here, we are talking about pediatricians. In our role as advocates for children, we believe that we have huge responsibility on our hands to make sure that school health program is well implemented. Nurses that we work with and also most likely will be the ones that will man those health clinics and sick bays in school. Health educators are also part of it. Environmental health officers, school guidance and counselors are also partners in that. Community health workers, dietitians and nutritionists, school teachers, social workers, and the community at large. So how can a pediatrician be empowered to advocate for effective school health program is what my co-presenter will take on from here. Thank you very much.
Thank you very much, Bashir, for that presentation. I would be taking this presentation from this point forward. How can pediatricians be empowered to advocate for effective school health program? During the Gombe PAN conference in 2025 January, we did a survey. And in that survey, we gathered information from pediatricians from different parts of the nation. And we were able to outline about 7 major points that pediatricians at that meeting identified as ways by which pediatricians can come in when it comes to school health program in this nation. And this would include health education and promotion, medical screening and healthcare services, capacity building and training, policy and administration. They could also come handy when it comes to school infrastructure and facilities, community engagement and partnership, as well as monitoring, evaluation, and research. How can we go about this? The first thing is health education and promotion. We know that while we were younger in the schools, we were always at schools. They give us specific things and they talk about specific health issues. But we know that pediatricians are more informed about the specific health needs of the school children. And so we could come in handy when it comes to giving health talks in schools, especially if we need to go beyond our clinics. I know that a lot of the times we wait at the hospitals for these children to come to us in the hospital. But we know that prevention is key and is the basic foundation for health promotions. We could also be involved with PTA meetings because we know that these school children do not stand alone. They are actually accompanied by their parents. And there are so many schools with established PTA meetings. And we could start by working with these PTA committees. We could work during medical outreaches and interactive sessions on healthy habits. Some of these habits we have spoken about, and some of the things we also found during the situation analysis that we conducted in all of these states in Nigeria. Particularly the issues of hand washing. We know that many diseases would be avoided if we have specific opportunities for hand washing and proper hand washing that will not only remain in the schools, but also the children will go home and involve their parents in this hand washing skills. And this other aspect of school meal is also something that is very important that we need to look into. I know that we have said that on the list of who should be involved is the government. There is nobody that can act on that except we have a buy-in with the politicians to reinstate the school meal program. And in some parts of the world, it goes beyond just even nutrition and the schooling. They also get involved with helping parents to start their own gardens. And this would also go a long way to improve the nutrition of the school child. And other things that we could also look at would include fighting childhood obesity. I remember when I was in residency, we did conduct some studies on childhood obesity and its prevalence in Ile-Ife. And some of this information that we got, of course, we were able to defend and then we'll finish the residency. But how many of this information do we go back to ensure that the findings of all of these surveys that we're doing, how do we feed back on this to these students as well as their parents? We could be involved in online seminars and training programs for the member of staffs. Like we said, empowering the teacher is as good as empowering the student because they are the ones that these children actually look onto. In recent years, about 2 years ago, we got some funding from the American Academy of Paediatrics by the Medical Women Association of Nigeria in Ogun State. And we did some mental health surveys. We did some mental health intervention. We trained some students in some of these identified schools. And through that, we were able to reach out to training the staff. And we also used these students as peer educators among their peers. And we found out that the post-intervention survey gave us really positive findings, which would be published any moment from now by the Canadian Academy of Adolescent Psychiatry. It's also important for us to know that as pediatricians, we may not be able to go all out and affect every school in our state, but we could use the hub and spoke model. We can help in establishing health clubs and societies in these schools, and they can have overall hubs that can help to mentor the schools as it involves school health programs and healthy health education amongst these students. So the question is, how can we also help when it comes to medical screening and healthcare services? We are looking onto a situation whereby the Paediatric Association of Nigeria would design a unified pre-entry medical examination and screening tool. For the past 15 years, there is a particular school in my state that a group of us, pediatricians are the leaders, we have ophthalmologists, we have ENT surgeons, and dental, no, not ENT, yes, and then dental. We've been going to this school consistently without missing it. I think we missed just 1 year during the COVID-19. And we've been doing this pre-entry medical examination. That tool that we developed was just developed within ourselves. But we are looking forward to something that can be unified so that every student that goes to every school, not just people who have opportuned or fortuned to go to private school, so that we can have an established pre-entry medical examination and screening tool, and we can identify disease early amongst those children. One of the other things we do in those schools is the genotype. Somebody was saying recently that they've been giving us so tiny money from the beginning. Up until this time, the funding really never changed. But I told them that how many of these people we been able to link to care, and that's more important. We could also help to conduct case management drills for schools. It would be of interest to know that when we did the mental health intervention that the M1 Ogun did, not only were we able to help these school children and link them to care by the psychiatrist, we were also able to link to care some members of their family. And up till now, they are still calling to say, those things you taught us, we saw it, we identified it. Because we went just beyond that, we also talked about issues of drug abuse. And many people, many families have been able to call us. And we also taught them how to manage a child with epilepsy, for example. And then we can conduct these case management drills for this school so that some diseases can be demystified. And then these children can easily be linked to care. It's also important for us to identify and ensure that there is proper linkage of school health personnel, both for training and referral. I remember that in those schools, we had to put up a referral booklet for them so that we'll be able to have proper record. If we look at when we did the situation analysis, we found out that very little record is available concerning children even at the school. So when we have trainings for them, they will have proper documentation, and ultimately there'll be proper referral. When it comes to capacity building and training, it's important for us to know that the civil service or even the teaching service commission, people always come in and go. Particularly with the Japa syndrome in the nation, a lot of people are leaving. So there may be need for us to retrain. Some teachers have been trained. I'm sure the very old teachers have been trained on key components of school health program. Because I remember when I was in the medical school, a lot of people talk about school health program. But some of these people have either retired or they have left the system. So we must continually build capacity by training and retraining. We must also provide guidance in the establishment of sick days. I remember when I went for the situation analysis in the suburbs of this state, of my states with Dr. Ogundeyin. It was very appalling. We saw a lot of boxes, a lot of first aid boxes, colorful. And some of the times when we opened them, we found only cotton wool, not even methylated spirit. So we need to begin to guide these people on how to maintain their sick day. And of course, what we were told in some of the schools is the moment they see a sick child, they don't want trouble, they send the children back home. And sometimes they don't care whether these children are taken to the hospital or not. And so through this, we may be able to have school health program champions. Like I spoke earlier about hub and spokes, specific schools that people would even be able to go and understudy them. And of course, we can't do this without a pan-led advocacy to the Ministry of Education. We know that the health education has been incorporated into the school curriculum, particularly the civic education. But I think we may need to look at some of the information. I remember when my children were in the primary school, they will sometimes tell me things about their civic education, and I feel that this information are actually spurious and they are incorrect. So it's important for us to get involved, particularly at the level of Paediatric Association of Nigeria. And then we may be called upon in our different states to be part of what is incorporated at the level of the school curriculum.
Okay,
so when we also talk about community engagement and partnership, like I said earlier, and which was something we experienced firsthand during the mental health intervention that was done in the States, we were able to strengthen the Parents Teachers Association community. And you'll be surprised. In fact, it was one of the outstanding things during that intervention. The parents were all excited to be there. And they felt, because we also made some booklets on mental health intervention that we gave to the children to take home. And some of these parents actually read through these booklets. We made it very simple. And they were enlightened and they had better information. It's important for us to know that children cannot, like we know, ethically be separated from their parents. It's also important for us to organize awareness campaign and community mobilization and relations. I remember when we needed to enter the community at the school level. Although we had taken consent from the school, we went to the Ministry of Education, the zonal education office, and all of that. But just informing and getting important stakeholders involved made the work very easy. And then the parents are still calling us. They have our phone numbers. They are still calling us because there was the great awareness that we made, campaigns that we made at the school level. And some schools even called us, why did you ostracize us? Why didn't you make us part of this program? And we told them that they were specific because we had limited funding. It's important for us to also know the spirits. Community leaders and important stakeholders that should be involved in this. And of course, the issues of policy and administration. We know that there's a very lovable relationship between the Ministry of Health and Education, particularly when it comes to issues of policy implementation as it affects school-age children. We also need to get involved. There are policy documents. Some of them are gathering on shelves. And we also need to ensure at our different states that things are not done without the pediatrician. They need to get to know us. Recently in the committee, we're trying to gather names of those people who will be willing to work with the community at large to be able to represent their different states. So going forward from this meeting, if you are interested, please kindly contact us. We want specific people at different states who will be willing to take up that bold step of getting involved with the school-led program. And we cannot do it without these two major ministries that we've spoken about. We are also calling on the Paediatric Association of Nigeria that we want school-led program model schools so that people would know. We know we cannot reach out to every school at the same time. In our different states, we could identify specific schools, not necessarily private schools, because we know that many more routes, particularly when it comes to the school-led program, is actually going on in government schools. So we want us to look at specific model schools. I know that the public health physicians are doing a lot when it comes to this. So pediatricians cannot afford to take a back seat. We need to come to the front row. So when it comes to the issues of monitoring, evaluation, and research, it's important for us, I actually desire for us to do that sit-down again, maybe at a larger scale. We are still looking for funding. We are planning to do more. You know, we had a lot of data that we didn't even have information on. So we want to do regular monitoring and evaluation of health programs. We want to conduct more research on school-led issues. We don't just want people to see the school as a place where residents can just go collect data, submit their proposal, submit their write-up to the colleges, and allow these things to lie on the shelves of our postgraduate medical college. We want a concerted effort. We want information that we get from all of this research that we have done. We want to gather them together and then use them as evidence to drive the change that we need as it affects school program. So in conclusion, I want to say that pediatrician would be playing a multidimensional role in school program, particularly if we look at the different recommendations, 7 recommendations that we got from the Gombe survey. We need to know that change is something that is constant, but there is always resistance to change. It's important for us to learn program and operational research on school health program. And that we should know that the perception of the reward of such interventions are actually very clear. And when we go all out to do all of these things that have been recommended, we would ultimately improve the academic performance of these students. And will also improve the ability of the teachers to impact knowledge on their students. I want to appreciate everybody for listening to us. And we will be moving into the interactive session. On that note, I will call on the chair to take over from here. Thank you, everyone. These are references.
Thank you very much, Dr. Dedeke and Bashir, for this wonderful recap on issue concerning school health. And we've laid it before us, the idea of school health, and the challenges we found on ground when we did our situation analysis, at least to establish a baseline. And we've made an effort to see how we can make suggestions of things that can be done. But we know that the list is not endless. And there are a couple of things that we can do, both as an individual, as a group, as a member of a community where we find ourselves, and any group that we belong, with the mindset of improving the health of our children while they're in school. And I think at this point, we may want to make it more interactive by inviting questions, because we know that questions and comments, directive, modification of some of the things we've suggested, because school health program is not new, but I don't know whether I have the authority to say that it has been abandoned over a period of time. And thanks to PAN, who felt that it's time to pick it up and see how far we can impact on it. So at this point, I want to throw it open to each and every one of us to come up with our questions. And for us to be a little bit early, if you have any intent of asking any question and making any submission or any clarification, comment in whichever direction you may want to go, just kindly indicate so that we invite you to speak. We give responses where we do have response, and as well as take note of those that we're going to work on. So thank you for listening to our presentation. We look forward to a wonderful interactive section. So we invite your question, comments now. So if you have any, just raise your hand, use your computer hand, raise it up so that you record upon to speak. Hello, are we there?
Yes, we're here.
Okay, so we invite your question now. Okay, somebody raised it. So.
Thank you, Mr. Chairman. This is Dr. Tabansi. While we're waiting for our participants to give their comments or questions, I want to say thank you. This presentation was very nice and so many points to be noted, especially the 7 points she talked about where pediatrician can come in as advocate, and then the use of the hub and spoke method, which is exactly one of the platform is what this iEcho platform we're using is about. We actually used it for an educational series during the COVID, and the platform was available for us to continue even till now. And I think Dr. Dedeke was part of that program. It is very good way to train and educate. Yes, so I like that idea very much. Another idea I may want to suggest, because like you said, we cannot keep waiting for things to be right. Pediatricians, we have to act as child advocates. So Madam President is here, and many of our PAN-ESCO and our members. I want to see whether we can use that model that we just recently concluded for this, our immunization champion. Of course, a lot of attention and funding is paid towards immunization and vaccine preventable diseases because they affect children less than 5 years, and the mortality and morbidity indices are very high. But subsequently, the child has acquired some immunity, is fairly healthy through the school years life. I don't know why, maybe as the chairman, Dr. Maduka said, that's why school health has gone to the backburners, because they are not really actively sick like that, but they need to be monitored to find out these things. So I want to suggest, Madam President and our members, if we can use this immunization champion that we've just talked, where we get champions for each, like the school health team has. So a school health champion, and most importantly, components or social media influencers, like we try to do something different to really take this advocacy for school health program to another level, engaging the PTA like has been suggested. So I really enjoy this topic, and these are the things that I'm just thinking about, just as she was mentioning. School health clubs, that's also another great one. It's been, PAN has really been interested in this area. So thank God we have a vibrant school health committee that can help us. Maybe you can help us first with that unified document. That would be really awesome. Madam President, you want to add? Okay, I can see some hands now. So, Chairperson. You can take on from here, but these were some of my thoughts as I was listening to the presentation. Thank you.
Okay, maybe I can speak after the hands. I see a number of hands. Thank you.
Okay.
Okay, so may just need to, in no particular order, but based on the way we're seeing it here, may I invite Enato as a Hua. Your hand is raised, so you can come aboard and let's hear what you have for us.
Okay, thank you so much. Good afternoon, everyone. My name is Dr. Zeyiwa Enato. I'm a consultant pediatrician. I'm based in Edo State, and my chief mentor is Professor Sadu. And I really want to say I want to thank her for reminding me to join this Zoom meeting, because I have a great passion for school health itself on my own, and together with or in partnership with organizations and some hospitals, we've been able to kick off an effective school health program in some parts of Edo State, particularly Benin City. So we've been reaching out to schools, and from my experience, the truth of it is that it's easier to reach out to private schools. Some of the state schools, I don't know if it's Edo State particularly, but there seems to be a lot of bureaucracy. You know, I used to think that it was easy to just enter into state schools and get what you want. But, you know, the process became very tasking, and it was actually easier to reach out to private schools. And the response was remarkable. And for the past 5 years, we've been going to several schools, and the impact has been fantastic. But what I want to suggest, in addition to the beautiful suggestions made by the presenters, is that collaboration, because one problem with school health program has been too many intersectoral collaborations that have been very ineffective. And that's one reason why I believe school health program has failed in Nigeria thus far. But I think the collaboration should be focused not just with government, but also with private institutions. Private institutions for, like, I'll just give a typical example. Already there's been, should I say, good cognizance to Professor Sado in the Institute of Child Health. They've started a program, a diploma program, and it involves school health program, teaching some students, diploma students on school health program. Then another collaboration would be with hospitals, private hospitals and private institutions, NGOs, because there are several of them that may be interested in boosting school health program and services. Also with these schools, collaboration with the schools itself, with themselves, you'll be surprised at the number of persons that don't even know, number of schools that are not even aware of the National School Health Program policy, based on the data that was given even in this presentation. So I would suggest that the collaboration should not just be focused on government institutions like Ministry of Health alone or Ministry of Education, but I think as a pediatrician, to be more effective, we may need to get private collaborators as well. Then from suggestion concerning parents, PTA, that's also another effective collaboration, which has been working for us. And in fact, currently, we just completed it last year, because every first term, we actually reach out to these schools. And training of the teachers is actually very effective for us, because we go ahead to teach them even basic resuscitation in schools, how to do CPRs, the choking, how to use the choking, when there's a choking child, what to do, basic first aid. So it's been very wonderful, and we've been able to link a lot of these schools to private hospitals that are close to them, and even some government hospitals. And the parents have been very, very happy about it. So I just want to commend PAN for taking up this initiative, and that raising up champions or encouraging champions in each state is actually a great idea as well. Thank you so much.
Okay, thank you very much for that. Okay. Okay, so I invite Professor Sado to give his own comment or question of that.
Okay. Thank you very much, Professor Ughasoro and your School Health Program Committee. And I also want to thank PAN for giving you the platform to express your passion. So I want to speak from our experience as immunization champions to note that while we worked with various sectors, the education sector was very resistant in some states, and they opposed the introduction of or the use of their schools to administer the HPV vaccine. At a recent meeting where the National Primary Healthcare Development Agency tried to streamline all actors in the immunization space to align with the national objectives, the issue came up for discussion. I think that it's a very important factor for the health and education ministries to work together. We will not achieve so much if the two ministries do not agree to collaborate. From the presentation, we can see that the health sector has an important role to play within the school health program. I think part of the confusion has been whether the school health program the Ministry of Education or whether it's been administered by Ministry of Health. Whichever ministry is responsible for administering it, I think that both should collaborate for effective implementation of the program. Yes, the pediatricians and other interest groups can get involved, but we will not have a holistic impact if we do it just from that perspective alone. So we need to get to the national level where we involve both the Ministry of Education and the Ministry of Health coming to the table to sit down and articulate what needs to be done. So I think it's very important that the Education Ministry and the Health Ministry sit down and talk together about the school health. Judging from what the last speaker had said, there's a lot of resistance from the state-owned schools because the Ministry of Education would not give them permission to do the needful. That's why the private sector, because they want to improve their selling points and improve on their clientele, would embrace school health programs, which parents would find attractive, but the state-owned schools or the public schools are reluctant to get involved because they have not received instructions from above. So we need to work from above. And I think that PAN can get involved in the advocacy to Ministry of Education. Thank you.
Okay, thank you very much for that submission. And I believe before we round up, we'll try and find how best we can articulate all these submissions. So I'm calling on Dr. Chinyere Uzodimma to make her submission. Hello? Dr. Uzodimma, are you there? Okay, while we are waiting for her, Tunde, Dr. Tunde, you can speak now.
Okay, so thank you very much for putting this program together. I think it's very important that we all engaged with school health program. So a quick question. A hungry child cannot learn. And we know that. Just want to ask the presenters, what is the current state of the school meal program now in Nigeria?
Okay. Okay, is that all, huh?
Yeah, sure.
Okay, it's all right. So, Dr. Uzodimma, are you there? It's like she has gone out.
I'm here.
Okay. Can we get your submission?
Thank you very much. I want to thank the presenters for a beautiful presentation on school health. I think a lot of schools would want to key into school health because my name is Dr. Chinyere Uzodimma, Federal Medical Center at Paediatric. Dr. Dedeke is from my center. Thank you. So, schools would want to key into school health program, and some of them are actually doing things out of not knowing exactly which way to go. I think it was 2 years ago that in Lagos, it went round that a particular secondary school asked all their students to go and run ECG as part of screening before they return to school. And they were looking for where to do ECG and where to report it. I think about 1 year ago too, another school sent out message to their students to go and do EEG. That one I was shocked. I said EEG as part of screening for school entry. So the schools really need some guidance. And I think one of the things that comes to mind that would be something that is like a low-hanging fruit would be to collaborate with the state governments. I know that state governments have their school management board, education management board, and they have consistent collaboration with every school in the state, including private schools and government schools. And under this collaboration, they're able to say that this is what we expect from schools. So I think one of the low-hanging fruits is the standard pro forma, or what we think would be the minimal thing that the school can do for the students or would require the students to do at the point of school entry, is to share this with the state governments and see how they can bring this, incorporate it into the guidelines that they are giving to the schools to be able to operate. I think this is one of the low-hanging fruits that we can, pick up on and be able to achieve in a short time. Once again, I want to thank the presenters for bringing this up. It is a fantastic thing. Thank you. And also to the leadership of PAN. Thank you, and over.
Okay, thank
Close
you.
The gates now.
Okay, thank you, Dr. Uzodimma, for that submission. Before we try to respond to a couple of things, yeah, I know most of them were like suggestions, but there are one or two that we may need to elaborate a little bit on. There are a couple of charts that we may just want to read out. Probably there may be more things we respond to. The first from Ochoku of TB and Leprosy Control Program. It's just appreciating Professor Sado for the great point she made, and we are looking into this area. Okay, thank you. Thank you, Ochoku, for that.
They were complaining that there was...
Hello? Can you hear me? Okay, probably it's not for us. Okay, then the next submission from Adenola. Just appreciating the presentation, and I said my concern most time is on monitoring and implementing and evaluating, which is key. Policies are not in place, but policies are in place but not effective. Also, there is knowledge lacking in some places. Why some schools having heard about it. I also like the submission from the president-elect and hope that if we use the school social media well, we can do more sensitization and then be able to make more awareness and follow through with proper implementation, monitoring, and evaluation to achieve this. Everyone can start in their little corner, especially those with kids at primary, secondary school, by discussing the need and establishing need in the school. This will gradually be a drive and can achieve more at central stage. Thanks once more for the lovely presentation, Ma and Saz. Then from Yusuf, actually the collaboration between the education ministry will no doubt improve the health status of our school children. However, there is also need to reach out to all relevant stakeholders, reminding them on the Child Rights Act, which emphasizes on the general well-being of our children. Big congrats to all presenters and to PAN for making the event very lively and the support. Thank you. Thank you, ma'am, from Raji Faidat. Said, thank you, ma'am, for that beautiful presentation. It's a learning point for the residents. Okay, so I think these are the much we have here. And there's no other new hand raised. I believe the one from Menato, we've responded to that. So quickly, one that looks like a question is the issue with New Plus. We don't really have any authoritative data on that. Whatever we are going to say will be on our assumption. I don't think that, especially in the public schools, it's not being implemented from what we found out. In some places, we ask them questions, about that. The only thing they did was just a giggle. They didn't give us any response. So from that body language, you realize that it's not being implemented. Even in the private schools, that the only place we have any information about meal is those that have a boarding house, their boarding facility, because they feed them. So more or less from these information we're able to gather, I don't think that the school meal plus program is being adequately implemented. And even in places where they're implementing it, it's not adequate. It's something that we really have to find how to look into or highlight the deficiency in that area. And secondly, in the submission from Dr. Ozodimma, you really touched an area that we've already been working on. You know, it's one of the things we'll have in our strategic plan to look at. We've already started the design to have a harmonized, abridged pre-entry, a kind of a standard form that will be filled before every child will be admitted into school. And we are not even stopping at that, because when we asked around in our survey, most schools were like, yes, that they do ask for entry assessment form that is satisfied by a doctor. But the next question: what do you do with those forms when they submit it? The only information we got from survey that they just file it out. So you now realize that the real essence of that pre-entry assessment is not being fulfilled, because it's supposed to be analyzed and try to identify those children that have some challenges, be it hearing, be it vision, be it whatever, even mental case as it may, so that they will start early to institute some intervention. So one of the things we plan to do is design a standard screening form, and also develop a good algorithm that can link all the submitted form to where they will be analyzed, and probably now send a feedback back to the school and other areas they may receive care. You know, so it's something in pipeline. It's something we really need to think through. But before all those things will be effective, that collaboration between Ministry of Health and Ministry of Education, because you don't make policy, you don't develop documents where you don't have an authority. So I believe that this is just maybe like the starting point. By the time we'll gain traction and we'll progress, at a point, the Paediatric Association of Nigeria will surely lead that advocate visit, where we'll bring all these people together and also decide things that really need to be done. Even beyond that, we know that as we speak now, the only policy document on school health in Nigeria as we speak is the document of 2006. So by next year, it will be 20 years. And one thing that will really show you where the attention is going is how current the framework, which is the policy document, is. So for you to have a document of 2006, that is the current guiding framework for school health, it's obvious that no attention is being channeled in that direction. And it's something that really has to be done, something really needs to be done in that area. At least having something that is current and see how best it can be implemented. So the last comment on the chat, I was talking about policy document. On this issue, I don't think we'll have a current policy document. I think that's the first thing we need to do. Develop it before we now talk about implementation. And in this time around, all the key stakeholders involved should be be invited to the discussion table. Because from experience and from some survey that I've done, one major challenge that affects most of the policy document developed is that it always comes as an ambush to those who are supposed to implement it. They don't know when the idea was conceived. They don't know the process about it. You know, they are just there, and next thing, a document just lands in front of them. The best thing to do is to, ignore it and do whatever. So this time around, if it's going to be done, all the key stakeholders should send in their representative, so that they will bring in their quality, bring in their own perspective to that document, and be aware that such a thing is coming. And like in the presentation, the aspect that Dr. Dedeke talked about, change is a very difficult thing. because when you go through the theory of change, there are different stages. One of them is readiness, and the other one is accepting that something has to be changed. So without going into too much details, we are looking at developing a standardized screening form that will be filled by somebody who can analyze it. And the school should also be meant to be aware of benefits of such documents so that the children will benefit maximally from what that idea of screening before they enter school supposed to present. And collaboration, we can't really exhaust discussion that. But in the presentation we made in Bombay, because then we came with the idea of whose responsibility is school health program. Yes, school health is under the Ministry of Health, but some of the key components are supposed to be implemented by Health Ministry. And since there is this conflict, people tend to be abandoned. We're even suggesting, could we extract school health services, which is purely health, as a standalone program, so that the Ministry of Health will know that this is directly what we're supposed to do. But the argument that ensued after that was that you can't balkanize school health into its fragment. It won't work. That they still have to remain, all those 8 or 9 components of them still have to remain under school health. But all the ministries that are responsible for each of these components should be called to mind. They should be aware that they have a duty to perform in this area. And probably with constant interaction, reminding them of something they have to do, they will, at a point, start doing something that will improve school health. And its time is right now. I'm just speaking directly to PAN as a body. There's more school health subcommittee can do. But the time is very right now for us to move, because currently the Ministry of Health, which I'm sure of, is very particular about annual operational plan for each state, meaning that whatever you're going to implement the coming year, you must have, clearly stated. And if school health is not clear under Ministry of Health, there will be minimal they can do about it. I know that some of the components are scattered in other areas like the RAMCA, all those sort of things. They're out there, but without bringing it under that roof or canopy of school health, there will be minimal they will do in school. And like we've mentioned, even our colleges, both West African and national, there's also need to, remind them. Some of our residents that are doing our part 2 works, we just go to school, we do our study there, and that's just the end. No, there's no form of feedback. The findings will all help them to do their part 2 exam and publish it, and that is that. But the primary source may not even know the things they really found out. So there are a couple of things that has to be done, but the only thing that can bring all these things into crystallize it so that somebody mustn't necessarily be in this kind of gathering to get to know about that is to develop a document, policy document that speaks to school health. We may not be able to develop for the nation because we are not the custodian of school health, but we can develop for PAN. And the committee is already thinking of developing policy document for pediatricians. At least this area we are sure of. Not as if we can't do for that, but we have the jurisdiction, if I want to use the medical term, legal term, or the authority to develop a policy document that will now remind pediatricians and other allied health workers on things they can do, with regards to helping to bring a school health program in the right pedestrian as the case may be. And also, by proxy, remind other ministries what I expected of them to do. So more or less, this process is an evolution, and we think that we are gradually, navigating through, and very soon we'll be able to, usher in a new dawn in area concerning school health. And then I think basically we've responded to that. I don't know whether any other person has maybe a couple of things then to do or say before we'll hand over to Ahmed. Okay, over to the presenter. Maybe
All right. All right, thank you very much, sir. What I just want to add is, or emphasize, is that synergy that is needed between the Ministry of Health and Ministry of Education. Because even if the document is developed by the Ministry of Health, the implementation has to be by Ministry of Education, because they are the ones that own the schools. So I think we need to really emphasize that. Luckily for us, one of us, a doctor, is now the Minister of Education. So this is an opportunity for us as PAN, if we want to reach out for the purpose of bringing to the fore the issue of school health program, policy development, collaboration with the Ministry of Health to sit down. And he was from the Ministry of Health, incidentally. He left Ministry of Health as Minister of State, and now he is the Minister of Education. So I think that synergy needs to be exploited, and the opportunity is now facing us, is presented to us, where both ministries are headed by our colleagues, doctors, which I'm sure we can actually work with them to see how far we can go. With respect to the school meal programs, you know, there was a policy by the federal government on school meals, which was domiciled under the Ministry of Humanitarian Affairs or something. But the last thing I know about that was that it was suspended because of allegations of corruption and all what's not, which we are all aware of. And there was a lot of politics also in the whole operationalization of the program, such that even the contract, the main attention is who gets the contract to provide meals to which schools and all that, rather than the actual thing in terms of quality and spread of the meals that are given to those poor students. Thank you very much.
Thank you very much. So, Dr. Dedeke, I don't know whether I still have maybe like...
let me just lend my voice a bit to issues concerning school meal program. I think there are a lot of politics around this. And it's important for us to know that at this time in Nigeria, particularly with the level of the economy, we would have a lot of children come down, particularly school pupils in primary school, with malnutrition. So as a body, I think PAN may need to lend their voice to it. Because I know that, I remembered recently we wanted to do a project and we asked for some ready-to-use therapeutic food. And you wouldn't believe it, when that study was cancelled, that even parents were begging for the raft to eat. So I can imagine if we don't do something early, especially as it comes to that school meal program, at least we'll be sure that a child will be able to eat a balanced diet once in a day. So it's something that we may need to actually take to the rooftop to advocate for. Although I know that, just like Bashir said, a lot of politics go into this and a lot of people want to get involved because of what they can gain. But we'll still continue to advocate for the Nigerian child. And then the other thing is to say that we're looking at the community level for state coordinators. Please, if you are interested, reach out to us. If you can champion the cause for your state, we are collating the list of our state coordinators so that you can get involved even at your state level. And of course, I want to appreciate Professor Sado for the beautiful thing that is being done by the Institute of Child Health in Benin. Please, share with us. Let us know what you're doing at your state so that we can also percolate this at the different other states in Nigeria. And I want to appreciate everybody for coming and being part of this. We've made a lot of jottings and we'll indeed go back to the drawing board and get this school health program to the level that it should be. Thank you all for coming.
Thank you, Dr. Dedeke and Bashir for this wonderful presentation. So, in absence of any other comment, question, or clarification, and no hand raised, maybe let me check the chat. I noticed that maybe there's still a couple of presentation posts there. Well, they said, okay, just appreciating PAN, Maduka. Okay, just appreciating PAN for organizing this. And as Ebenezer Adeniyi said, as of 2022, when I did my dissertation in local government in Ekiti on school health program, school meal program is well implemented for pupils in primary 1 to 3. And at the onset, the meal was adequate and very good and good quality. But over time, that has declined. The current situation as of today, I'm not sure of. Okay, so it's still not off what you're already saying. So kudos to the presenter and the moderator. Well done all. Well done to both presenters. Congratulations, Ambassador. Congratulations to PAN and School Health Committee for this evidence-based webinar. I think that is that for me. So I appreciate and I want to hand over to PAN for this wonderful opportunity they've given us to refresh our thoughts on issues concerning school health. It's a process in evolution, and I believe that over time we'll be able to, get at least achieve some mileage in trying to reestablish school health programs so that our children, while they're in school, will be able to enjoy the full complement of being in school. There may be still more to discuss, but I don't know whether I'll have much time to do that. But like we said, you can always reach us directly or through the PAN secretary, to be part of this. We are inviting more ideas, more qualities, more collaboration, so that we will be able to get this school health program to the right direction or position. Thank you, and over. I'm handing it over to PAN now. Thank you.
Thank you very much, Dr. Maduka and the PAN School Health Committee. It's been a very interesting session. I want to ask the PAN president whether she still wants to make a comment. So that,
thank you very much, Madam PE, and a big thank you to the School Health Committee for an excellent job. Before I say anything, I want to find out if Dr. Ochuko is still on the platform. Dr. Ochuko, are you still here?
Yes, Prof. I'm still on the call, ma'am.
Oh, okay, fantastic. So we are very delighted to have you. So a special appreciation and thank you for joining us. And I actually would like you to say something. You see, you are on the other side. We are speaking from a different angle. And the question is, what do you have to say? Because I noted your comment and you did say something like, we're looking into this area. Can you give us a little insight into what is, in the offing before I speak? Thank you.
Okay, Prof, thank you so much, ma. I hope you can hear me.
We can hear you very well.
Okay, so we've recognized
Sorry,
the
so
fact.
that everybody knows who you are. Help us introduce yourself.
Okay, so my name is Dr. Urioke Ochuko. I work for the National Tuberculosis and Leprosy Control Program. I anchor the pediatric TB desk. So, like I mentioned, it's the issue of school health has been something that has been concerning to us because we realize that even for TB, when we go for outreaches, there are instances where we diagnose TB in school children, and even the 2024 Child TB Week that we conducted,
we diagnosed a lot of cases from schools. And because of that, we think we really need to prioritize school health as an intervention. And just like it's been mentioned, the good thing is that the current Minister of Education is a medical doctor, and he was moved from the Ministry of Health to the Ministry of Education. So we are working to see how we can revitalize school health, working closely with our partner, Breakthrough Action, that is very good with social behavior change as it relates to TB and other health services. So we've actually, and I remember discussing with Dr. Maduka in Gombe State, we would have moved on with the conversation with PAN, but because of the recent developments, the USG, the freeze of the USG funding, it made it difficult for us to continue the discussion with that partner that can, the technical partner that can really support us and make us have an inroad. So because of the developments around the support for the program as it relates to USG funding, we decided to slow down and just watch events unfold and see how we will go about the engagement. TB is a vertical program, but as a senior official of the Federal Ministry of Health, we don't want to look at it as a TB activity, but rather using TB as a program that can help to strengthen school health services, bringing other stakeholders on board, the Child Health Division of the ministry and other relevant stakeholders. So it's a priority for us, and we're willing to work with PAN, but just because of the recent developments as it relates to funding from the key partner that is trying to support us, we decided to, slow down and see how things unfold. But I just want to say that it's a priority for the government because the National TB program is part of the government. And we would have written to the coordinating minister to endorse the engagement with the Ministry of Education. But we said, let's just slow down because of the recent developments and see how we'll better engage. So I'll be calling Dr. Maduka so that we can, better strategize on the best approach to going about this engagement. Just to also say that we recently developed a multi-sectorial accountability framework for tuberculosis, and the Ministry of Education is one key ministry that is supposed to support us. So that framework is also an avenue that we'll use in engaging the Ministry of Education. But for school health, we'll be looking at it in an integrated with an integrated approach in mind. So we are open to working very closely with PAN to ensure that we are able to revitalize school health in Nigeria. Thank you.
Thank you very much, Dr. Ochuko. I think that was quite enlightening, and you hit the nail on the head, precisely where I was going. The issue in Nigeria from observation is that funding drives activity, and it is the interest of funders that determines what is happening in the space. Unfortunately, in our country, child mortality, under 5 mortality, neonatal mortality, infant mortality is a big issue. And so a lot of attention and focus is directed at interventions that are considered most impactful to reducing those mortalities, which is probably why school health, unfortunately, is not getting the funding and the attention that it deserves. the recent events in America, of course, we are all aware of the implications. And for some of us, maybe it will be time for us as a nation to see exactly what things we should be doing and provide funding for those things, now that probably some things are not going to be dropping from where they used to drop from. Because wherever the money comes from, that determines what happens. So all the points made are very valid. The need for the Ministry of Health and Education to collaborate on this, and PAN recognizes the importance of school health and will continue to work along with both government and the schools themselves. We have heard about reaching out to the states, and it's also a good point because the truth is, even when policies are at the national level, if the states don't feel up to it, they do not comply with those. There's still a big problem with subnational support of national programs. So reaching out to the states is still something that needs to be done. But as we were having these discussions, one low-hanging fruit that came to my mind is many of our doctors, where we have children in schools, we're in PTA meetings, where in those meetings, what voice can we lend in those meetings in terms of advocacy for school health? Can the school health committee come up with just brief information that can guide our residents? They all have children in these schools and they're attending those meetings. Just a guide on, if you're in that room, you lift up your hand, can you raise this point in that meeting? I believe that if we disseminate such concise, key information, that we would start to be saying something in the rooms of our meetings in places where we go to. Now, concerning the school health program using the same model as the immunization program, I'm sure the meeting Dr. Sado mentioned earlier, because in our report, we did talk about the challenges we faced in schools and how we can link up the immunization programs with the school, with education at that meeting. And it was very clear that something needs to be done to make that connection. So it's something that can happen. And it could actually be a collaboration between the immunization champions and adding on some people with focus on school health to still drive the same process. Those are some of the missed opportunities that we found where we're just looking at one thing, which is immunization, whereas with those opportunities, we could actually do other things. And school health is one of those, raising that awareness in those schools and places that we go to. But the committee needs to help with very clear key messages that pediatricians can be empowered with, to know that when you are in a space, when you have an opportunity, when you are in that room, raise these issues in those places where you find yourself, and a ripple can begin to form. So on that note, I want to thank everybody for coming and for these wonderful conversations we've had. I therefore hand over to PE to close the meeting. Thank you very much.
Thank you very much, Madam President. Thank you, everyone. A lot has been said. Let us one call to action. So the meeting is hereby closed. See you next month for another interesting session of our PAN webinar series. Have a nice day, everyone.
Thank you. Thank you, and well done to the team.